Hello, greetings from Chandray Hospital. I am Dr. Shruti Desai, Clinical Fellow in Rheumatology and Immunology, Bangalore. On the context of Patient Safety Awareness Week in the month of September, we're going to be talking about safety measures in chronic arthritis. Why we have chosen this topic again is because chronic arthritis, it can affect different areas. It can impact on a lot of it can impact you on a daily activities, and also it can cause a significant impact on your life activities itself. So when you look at the different areas, so the chronic arthritis can affect different joints. So be it your hands, be it your shoulders, the knees, the back, the neck, all of which can impair your daily functioning to a significant effect. Also, it can lead to a lot of deformities. It can cause a lot of changes in your skin, and also this can lead to mental stress and a lot of psychological issues. So, in order to deal with them separately, so we're going to give you certain tips and safety measures how you can manage them, so that you can have we can manage this arthritis in a better way. The foremost important thing, the general measures what need to be taken in the long-term management of arthritis is, as we always say, that the medications play an important role in managing chronic arthritis. The arthritis can be in various different forms. So they can be a part of the autoimmune conditions, or they can be part of the degenerative, that's the age-related processes. So in all of these conditions, the medications play an important role. One, to reduce the inflammation or the autoimmune condition itself, or to reduce the process of the arthritis. So the medications, based on your diagnosis, we have prescribed the various combinations of the medicines, which has to be taken at the adequate dose, at the adequate timing. The important thing is, do not skip your doses, and also do not overtake. Like, for example, if you prescribe painkillers, we would have told you take maximum 10 in a month. So some patients, because of the worsened pain, so they continue to take. So in those things, we sometimes this can cause effects on the liver and the kidneys. So we want to be very cautious about these things, and also avoid any other general over-the-counter medicines where we go to the pharmacy and they give a course of steroids, or any other doctor prescribing steroids. So we would like to avoid these over-the-counter prescriptions also. So if any concerns with your medicines, any concerns about its side effects, any issues you develop with the side effects, always discuss with your doctor, and we can modify them according to the clinical requirement. And also, do not worry about the side effects, because these side effects are always monitored. The follow-up visits are, one, to look at the improvement, and number two, look at the side effects. So we will be monitoring for the side effects, and only when we are sure that the medicines are safe to be continued, the medicines will be continued. Apart from these safety measures along with the medicines, the other lifestyle changes goes a long way in managing the chronic arthritis. So one is the regular mobility and the walking, the regular exercises, the stretching exercises, yoga, the warm-up exercises. All these become very, very important. A healthy, well-balanced, nutritious diet also becomes an integral part of the management of the arthritis. And avoid any other habits like smoking and alcohol. A complete stop to these habits. Then if you come to the specific joints, how we can deal with, what are the measures we can take to deal with the specific joint pain and the inflammation. So if you have a lot of hand pain and the stiffness, so what are some of the measures that can help you? Is you can have a regular hand exercises, dip your hands in the warm water early in the morning when the stiffness is more, and do the exercises that will be prescribed to you. If you have a lot of deformities, or the hand inflammation, then they can again affect the activities like the cooking and the chopping. So you can always take help with these activities. Avoid putting strain on the hand or the wrist. So if you have a lot of inflammation, avoid putting pressure on your hand and getting up. So avoid the pressure or the weight bearing on those affected joints. Avoid lifting heavy objects during acute inflammation. And if the pain is severe, then there are other assisted devices like the hand splints and the assisted devices that can help you. If you have knee pain, which can significantly affect your mobility, So what we say in those cases is avoid complete weight bearing on the affected joints. So you redistribute your weight being carried, where things like knee braces and kneecaps will really help you do the regular knee strengthening exercises, and use a stool when cooking or standing for a long time. Lower back pain, the lower strengthening exercises will help you. Wearing a lumbar belts will help you. Good posture and the function training by the physiotherapist. These are all things that can help you. Foot pain, the splints are the basis to support the joint. You can have orthotic devices or the specially made shoes to help with the foot pain or the deformities. They are recommended. And the assisted devices are the modifications to aid in challenging tasks. Like if you're walking for a long distances, these assisted devices can help you, along with regular exercises and the medicines, of course. Then there are certain modifications that you need to be doing at home. So how do you cope at home? So all of us have different type of work. Some work requires sitting for a long time. Some work require hard work, lifting heavy objects. So you have to modify your work conditions, or you have to talk to your employer based on your the arthritis and the requirement, and make adequate modifications at home, at work. So if you're sitting for a long time, if you're using this computer for a long time, so then always maintain a good posture, good neck posture. Get up and walk about every 1 hour or so. Keep yourself mobile. If you're lifting heavy objects, concentrate on equal distribution of the weight, or take help. And take help of the assisted devices to cope with work. Then coping with the deformities, as I was saying earlier, so we have a lot of the supportive devices or the assistive devices like the braces, the splints. If you need help with handling the writing or simple things like cooking and chopping, so you have a lot of assisted devices that you can either talk to the physiotherapist or the occupational therapist. And so is goes for the foot deformity as well. So you get the toe separators or the foot splints or the braces, and further assisted devices to help you get in and out of the bed. Other modifications you can do at home is again, you can have custom made the toilet seats or the chairs. Take the help of a frame or a walking stick to help you to keep you mobile. Then with all these things, of course, there will be a lot of mental stress or the psychological issues, as I was talking. So, but always remember that you are not alone. Always talk about your issues to your doctor, who can guide you appropriately as to how to get help, or how your issues can be solved. Talk to your friend, talk to your family members, take help wherever it is required. There are always the support group or the group sessions or the group discussions that will be happening among the patients of the similar conditions. So to take help of the support group. Yes, remember that you're not alone, and we can manage any issues. So with this, I hope that the safety measures and all these things will be kept in mind, and the safety measures will be taken. Thank you.